Assalamu alaikum wa rahmatullahi wa barakatuh. For this session, we'll start with the community health nursing session, disabilities and health. The objective for this session, we will define disability, we'll discuss the community living need of people who have disability. We will also we will see the misuse or the services for individuals with disability. We will also describe the ethical issues related to disabled people and discuss the role of the community health nursing in caring with population with disability. From your course book also we will one objective is there, which is listing the agencies and institutions which provide educational and rehabilitation services for disabled in Oman. The definition of disability, it is physical or mental impairment that substantially limit one or more of the major life activities of such individual. So, physical impairment or mental impairment that lead to limitation of life activities or recorded such as important and being regarded as having such impact. So we have to need to change sometime. We are using the Congress used the word disability rather than a handicap, which is currently more acceptable terminology than being or dealing or calling them as handicap. So they are saying to them ذوي الاحتياجات الخاصة بدل من المعاقين. Physical impairment, according to American with Disability Act, so American Disability Act, physical impairment, it means any physiological disorder or condition, cosmetic disfigurement, so physical disorder or condition or cosmetic disfigurement or anatomical loss affecting one or more of the body system. Example, orthopedic, visual, hearing impairment, and cerebral palsy, even HIV. So, mental impairment, any mental or psychological disorder such as mental retardation, organic brain syndrome, emotional or mental illness, and specific learning disability. Developmental disability, when physical and mental impairment manifested before the age of 22 that continue identifiably resulting in substantial functional limitation in 3 or more life area and reflect a need for lifelong extended individual coordinated service. So it means that disability, it doesn't mean that it is any condition, mental or physical impairment that need a short care. So it is the condition that need lifelong care. Community living need of people who have disability. We have this that might be their home, their own home, so they can be at their own home and the family are caring for them with the support from the community. An accessible community, so some of the community organization, they are accessing the people, or they have to access those community services organization, either for short stay or for long stay or for daily care. Meaningful work also, some it is providing them for work and training them, relationship with them, and also recreational activities. So community living need of people who have disability. Homes of their own, either with family or alone. They might be with their family, or sometimes some of the disabled, they might be alone with no support from family or with no family. Homes should be prepared based on the level of independency of the individual. So the home itself, like the stairs, like the bathroom, like bars that they can help themselves while they are walking, like provision of walker, like provision of wheelchair, also some equipment. Personal care attendant. Personal care attendant can be employed to assist the activity of the daily living, transportation, and household chores and maintenance. So they will help them in household, keeping their house and what to do, and helping them with daily life and also maintenance of the house. So, an accessible community is the very critical, and if a disabled person are to be participated in their fullest in the community life. Rural area are lacking adequate public transportation, which might affect also the accessibility of those persons to community services. Examples of needed services in accessible community: accessible public transportation to allow them to go to work and socialize also, and recreation, and seek medical attention. So in some of the country, they are preparing the vehicles, which is also that public vehicles also to be easily approached by those who are disabled. And in some countries also, they are free of, this services is free of charge. So they are giving them a card that they can use those public services free. Ramps, like large doorway with easily opening door, elevators, wide hallways. So those which is preparation within the community, and in order to be used by the handicapped or by the disabled person. How to help? Community health nurse has the role to educate the community leaders on the importance of those services. So because those services cannot be, it has to be provided from the community, and community leader, they have a higher impact on that preparation if they want to do that. Individuals who use wheelchair should be members of committee responsible to design and arrange their services. So because they know their need and what kind of services that they need. So because it's difficult for them to use the stores, so that vehicles, it has some slope that they can use. Also, beside the stairs, there are some slopes that they can use it for walking with their wheelchair or walk. Meaningful work. So society often judge an individual's worth by his or her productivity. So when the person himself, when he feel that he is productive, he can produce something, he can earn money, he can be independent in and not dependent on just the social welfare and those help. So his feeling will be better, and also his health will be better because he is away from this anxiety. Importance of working for those disabled. Being productive reduce the stigma of disability. So when you are productive, so even I am having some handicap or I am having some disabilities, but even though I am doing my work, I am earning money, so and in some of them they are also better in performing some activity better than healthy one. Offer opportunities for development of relationship, arrange social activity after work for them, and social network development. So we can arrange for them some activities and social activities after that to engage them with the community. Increase financial security for them also, and increase the independence and ability in the community. Increase the personal satisfaction. So that's the importance of work for a disabled person. The meaningful work, so vocational option range between day treatment programs and sheltered workshop to supportive employment and competitive employment in the community business. So the range is different. Competitive employment and supportive employment. Competitive, which has to be compatible with their disabilities, and so those who are having difficulty in mobility, they can do some work that while they are sitting, so in a station and fixing some parts. Supportive employment. Supportive employment facilitate competitive work for whom competitive employment has not traditionally occurs, and who because of the nature and the severity of their disability, need ongoing support services in order to perform their job. Supported employment provide assistance such as job cards, transportation, assistive technology for those people, specialized job training also, and individually tailoring support. The goal of supportive employment is to help the individual with the most significant disability, disabled, to be successful in paid employment in the integrated work setting of their choice. So those equipment that help them to do their work in the services of the community. Community employment provide the person with who have disability with a real job. So it will give them a real job that they can perform. Relationship. Sexual development of the person with disability is almost similar to some of others who are not having, normal person who are not having disabilities. Professional have two positions toward this need. Some things that disabled people should be allowed to practice sexual expressions, or other disagree, as they are concerned about the consequence of rape, incest, and the sexually transmitted disease. Overall, the community has a role through health education about sexual health care, awareness of those people. So sometimes the people and the family, they fear from that those people might be sexual harassment might be there when they are growing up, or sexual abuse might be there. Recreational people with disability usually participate in secondary leisures, TV watching, listening to radio, sitting with friends. This can lead to secondary conditions such as high blood pressure, because always they are sitting, high cholesterol, diabetes mellitus, obesity, so heart disease. How can the community recreation program help? Community recreational program can help by improving health and fitness of the people, increase opportunity of social contact, and improve quality of life. And now there are some group activities for those who are having disabilities. Some of the teams, like modified volleyball play, modified also football teams. So they are with some of the people with wheelchair also, they can play football, and which is with some modification, and they have competition with that. This will increase their ability, and this will increase their movement and keep them in a better health, and also psychologically it will help them. Recreational also example of activities, individual or team games, athletic program in school, college, and also sport in their sport activity, family recreation, plan activities, all of those can be helped. Why it is important? It will promote, as we said, their physical health, also improve their social skill, and facilitate friendship, and develop a specific skill for those persons. Recreation, community recreation opportunity range from individual skill building to a competitive international competition. So it might be just the individual skill can be enhanced, and they can use it for themselves. And as we said, it can be as competition, international competition, or national competition, and formulation of a club, and being a member within a club, and playing some certain activities with a competition with other country, and or with other teams from other cities. So this will help them to build a relationships, and also to do social interaction, and physically also it will help them. Consider that some children might require one-to-one assistant, so they might have need someone to be with them in order to help them for safety, or might need special accommodation to meet their unique learning or equipment needed, and communication style. Service for individual. So case management should be there. Educational program for those people according to their disability. Transitional from education to work and living in the community. So also this services need to, during the transition period, they need some help in order to be transferred to the work and to higher study. Rehabilitation of them, medical technology and medical aid and facilities that they can use. Non-medical assistive technology also, like wheelchair with batteries that can help with the remote control also. Assistance animals sometimes, especially for blind people, they can use their dogs for with them. Also from assistant technology, they are nowadays for blind, they are using sometimes some sticks that electronic one which help them to, and guide them at the road. Case management, it is a collaborative provision of coordinated care by professional from multi-discipline in one or more sitting over a period of time to achieve specific outcome. So it is multi-sectorial, multidisciplinary, to provide them and it needs time to provide them to some care. It is to have a specific outcome, like training of them in order to have a specific outcome. Like after that training, after that education, they can be able to help themselves. They can be able to open a workshop and do some work or work in other institutions. Case management team are not only serve the target patient, but also have the potential to improve the overall service system for the person with disability in the community. So they are helping the client and also help in improvement of the community or the services within the community that help those people. Educational program, interdisciplinary team, along with parent, develop an individualized family services plan, which is documented plan of care to meet the child and family need. Public school also provide every child with disability a free opportunity public education. So they have to study freely, such as physical, occupational, and speech therapy. So they are teaching them, speech therapy is the occupational therapy. School health nurse play a critical role in providing disabilities and safe school experience for child with disability, and to have a safe school and to do arrangement in the school that help disabled people to be engaged in education. Transitions from education to work and living in a community. So educational systems are expanded their role in preparing students for transition to work and living within the community. The key connection should be built with the community business, community college, recreational center, adult support, living to facilitate sufficient transition from school environment to work environment, and to prepare those people to be ready for the transition, for the transfer from the school environment to the work environment. Major options for students with disability include employment, further education, military services, volunteer work, so those will help them in their path. Rehabilitation aimed at restoring and optimizing the function after an injury or significant medical problem. So it optimizes the ability of the person or restore the ability of the person if it is after injury. Restore maximum level of independence. So the main objective is to restore the maximum level of independency functioning, advocate for optimal quality of life in order to live a better life, improve overall outcome of the individual. Medical technology used to assist with respiration, nutrition, exertion, and surveillance of vital function, and O2 level of those persons. So there are some, they might need assistance with respiratory function for breathing, like the oxygen, to get enough oxygen supply, to take their nutrition in a proper way. Example, ventilators, they might need ventilator, they might need nasal cannula, they might need facial mask, they might need nasogastric tube feeding that has to be provided for them. Non-medical assistant technology, it is any items or pieces of equipment or product system that use to increase and maintain and improve functional capability of a disabled individual. So area in which assistive technology is helpful are employment tasks. So they might need some device that will help them to do their work in the working area, or device to help them to do their activity of daily living, or device to help them to communicate with others, and for mobility and transportation. So those are the which will be developed by engineering according to those people. Evaluation for assistant device by appropriate interdisciplinary teams. They have to evaluate the need for those mechanic or those devices that can help this person according to his case. And assistive device move individual from dependence to independence, but include sometimes costly equipment such as electronic wheelchair. So sometimes, mostly it is, those equipment, it is costly because it has to be developed according to the individual needs sometimes. So they might need sometimes artificial limb that will help them to do their work. They might need special wheelchair equipment, electronic wheelchair or electric wheelchair. They might need electronic sticks or electronic eyeglasses. So which is costly. Assistant animal in 18th and 19th century, pets were used to give institutionalized people with mental retardation a sense of purpose and meaning. So they are caring for each other. Caring for pets help individuals to improve mood if they are caring with animal at home, lower their blood pressure, because it will reduce their anxiety, overcome physical limitation, and it will increase their social skill. Dogs are the most commonly used animal to guide the people, especially for blind people. Ethical issues that affect the care of person with disability: newborn routine screening without parent informed consent sometimes. So this is also when we are screening without the knowledge of the parents. In prenatal genetic screening, high rate of abortion might be there. Did this woman get the right information before they make the decision to terminate their pregnancy? Is the diagnostic procedure also is of a higher technology, and it screen properly that the pregnancy or the embryo is having difficulty and is having disability? Is it legal to do that or not? So all of that, it is ethical issues. Either might be accepted, might be not accepted by religion, it might be not accepted by the law. So it might be illegal. So those will create some dilemma and ethical issues. Area, those with disability getting equal chance of care. So are we providing care equally for those who are disabled as the others who are normal? Withholding life-saving treatment from those with disability, such as Down syndrome, hydrocephalus. So what we can do for them? Some people, they might withhold the medication from them in order to decrease their lifespan. Is it ethically to do that? So it is not those issues. It is related to the ethics, related to also against law, sometimes against religion. Ethical issues that affect the care of person with disability do not resuscitate or withdrawing life support. Sometimes, are we going, if the client with disability is having having cardiac arrest, do we have to do resuscitation or not? Those also will put us in dilemmas. Sometimes from their family, they will say, don't do the CPR for them. I don't know. It is a big ethical issues. It needs mufti sometimes to deal with these issues, especially in our countries and as Muslims. Use of organs for infant born with anencephaly for donation to others. Organs are taken while those infants are still alive. Is it ethically to do that? Are they there just as a spare part for others? So those are ethical issues that it is shocked sometimes. Overall, so professionals need to be aware of their own biases and consciously strive to prevent them from destroying the information from distorting information that they share with parents about risk and benefits. Services available for persons with disabilities in Oman. there is good articles to read about disabled in Oman. You can see this site and see the services provided for disabled person in Oman. There are some social institutions that will help disabled person. There are also the welfare, social welfare, Ministry of Social Welfare that support them either by training or by also financial support. There are many kinds, or providing them with equipment either through the Ministry of Welfare or through the local community services. Role of the community health nurse, it acts as a partner to help the person with disability to develop their own disabilities and knowledge. To develop their own abilities and knowledge, act as a change agent, change the service and try to cater to the need of the person with disability, act as a case finder. So the community health nurse, they can find the cases within the community, because sometimes the family, they feel shy or they feel the stigma of having a disabled child, because of that they are not letting him to go out of home. So in family assessment and home visit, we can also find the cases and locate young children with or at risk of disability. Case management, coordinate the case of the person with the individual with disability. So, and referral agent, she has to be a referral agent, direct the individual with disability to agencies that can help them to meet their need by providing contact number of that agency, or sometimes they are arranging with those agencies to help those people. Service as advocate also, to speak on behalf of those people with disability who are unable to speak for themselves. Serve as educator also to the individual and family and the community regarding dealing with disabled person and how to care. Caregiver, to assess and implement and evaluate the care for the disabled person. The agencies and institutions which provide education and rehabilitation service for disabled in Oman. It's institutions supported by Ministry of Social Development, so Disabled Care and Rehabilitation Center, and Care Home for Disabled Children in Muscat also. Also, Private Rehabilitation Center, Muscat Center for Autism, Creative Center for Rehabilitation, Rua Rehabilitation Center. So those are examples of private centers that help disabled persons. Also, rehabilitation center related to Association for the Welfare and Handicapped Children, Community Rehabilitation Center, Care Center outside Oman sometimes also, so they are sending them abroad. The agencies and institutions which provide educational and rehabilitation service for disabled in Oman, Assisting and Rehabilitation Service, Community Association for Disabled, the Association for the Welfare of Handicapped Children, Oman Association for Disabled, Al Noor Association for Blind, the Association of Elderly intervention for children with disability also. So those are some institutions that help disabled persons within the community. You have to identify and you have to be knowledgeable with the local institution which is available there in your community in order to help any case that you find in your community to lead them or to communicate with those institutions in order to get the better help. Thank you all.